12:30 I eat my lunch and take herbs and any required medications or supplements like vitamin, or I take evening primrose oil. This can take an hour because eating is really scary and I fear choking on food, which I have choked a lot in the past. It's one of the things that I have to live with, and I have to chew and eat very carefully so that I don't choke, and eat level food, soft 6 diets. Then I wash 1 or 2 dishes. I can't stand for long periods of time due to my back disability. I have some disposable dishes, plastic cups or paper cups and containers, so that I can throw in the bin, and there's no added stress on me to wash a big amount of dishes. I do not cook. I eat healthy, fresh, frozen meals and heat up vegetable bags, good quality soups, fruit and dairy-free yogurts, and drink, make up protein shakes with banana and things. I fatigue at 1, so then I need to meditate or start a meditation, but I'll often fall asleep. I set my alarm for an hour, but I often struggle to wake, and I'm these days finding that it's more like 1 till 3 that I'm asleep or in a state of meditation, a lucid state or dream state, or around 3 I'm usually up, sometimes 4 depending on how bad it is, where I am in the 12-week cycle, seeing my neurologist. 3 o'clock have warm caffeine-free beverage. A cacao has low caffeine, and maybe some 8 prunes, and do some gentle physiotherapy exercises. I might get a phone call. If I can't talk or I've got a lot of ulcers, I just text them and say that I'm not up to talking. And it took a while for some of my family members to understand that. So 6 p.m. just, I don't know, between 3 and 6 just arrives really quickly. And I'm careful not to be scrolling the net, or sometimes I can watch on my phone really good YouTube videos that might be positive, might be keeping me up to date on the latest in Parkinson's and Dystonia research. I have a gait in my walk. After dinner for about a year now, I crave dairy-free ice cream every night. I've never been like this my whole life, and it could be menopause, I don't know, but if I can possibly afford it, or occasionally my kids might shout me or send over some ice cream, they lend me money, I'll get delivered and feel guilty having the dairy-free. Oh God, if I could do one thing, it would be not have this dystonic thing, because it's awfully painful in my face and neck, and it is a daily struggle when you top it with migraines, ulcers and a few other inflictions. When I shower, it's usually around 5, so I stand for a while. But if I need to wash my hair because it is really long, I don't want to cut it. I don't feel I should have to do that. So I don't fall over or hurt myself or anything, because I live alone, which doesn't help the problem much. But I find when I shower and wash my hair, I end up sitting on the floor so that I don't slip. Combing my hair out, drying and dressing myself can take an awful long time, and I get really knotty hair, so that can take about an hour, and I have to dry everything. I'm like fastidious about drying everything between my toes, and I sit on the floor to do most of that. Combing, if I am not having a shower, I find myself just wondering how I ended up with such a wonderful children, and for some someone that's been actively healthy most of their life, why me? And I know sometimes life just isn't fair, but I don't know why me, why the lesson in that. And most people I ask, that I say there's sometimes some people just get the unlucky straw, and the bad things can happen to good people. But I know that that's not helpful, and I CBT myself out of it somewhat, having done a lot of that work myself with my own clients. 8 p.m. I tend to read if I'm not dealing with a 3 or 4 day migraine. Sometimes watch my daughter's Netflix channel on my phone in bed, or maybe journal a little until my hand cramps up and I can't write anymore. From 9 till 10, somewhere in there, I fall asleep. Pretty much every day I wake up with dystonic spasms in my neck. Mouth and jaw area. I ask we look at the full picture of her health and make a better informed decision. For example, if she's had a run of migraines leaving her fatigued, then there's no support to help her catch up on her daily chores, most of which she cannot do and which are outlined to this attached document. Maria has had a traumatic childhood, including incestuous relationship with her father, strangulations by 6 males and 1 female. She was allegedly raped violently at the age of 15, again held violently at the neck. She has now been fully diagnosed with all of the following conditions by her psychiatrist, Dr. Ellen Soman, Dr. Professor Soman Ellen Govan, Belmont Private Clinical Hospital. Complex post-traumatic stress disorder, ADHD, dyslexia, and GAD. I already had clinical depression, so I've had that since I was a kid. Dr. Soman has spoken with Maria, is happy to further support her with her NDIS claim. He has diagnosed her by her neurologist, has also diagnosed her. Dr. Melinda Pascoe has diagnosed her with, she's a neurologist, oromandibular upper cervical dystonia and chronic migraine as a disability. Dr. Pascoe confirms this is a total and permanent disability. Her prognosis is poor. Conditions like this will often worsen as we age, and I'm already 48. It's only supports that can be provided by medical professionals. She is managing her own pain management, but needs pain management. After an over-injection by a neurologist in Townsville, her system crashed physically, emotionally, and psychologically. At that time, she lost 11 kilos due to the over-injection of Botox on both sides of her tongue. And this cause, as stated in Dr. Melinda Pascoe's neurology report, significant bulbar symptoms with the difficulty of speech and swallowing. Maria had developed bulbar palsy. Please see attached report. Maria can supply voice videos if required. She has had to cease her counselling immediately and rest her voice as much as possible. Her voice is weak to this day. But imagine if your therapist was doing that, Anyway, Maria received steroid injection in her back. She ceased counselling immediately to rest her voice. Her voice is weak to say since the over-injection. She's been diagnosed with back pain, and she has assessed neck and back disability of 50% by a physiotherapist she saw for 2.5 years. Maria received a steroid injection in her back for the first time in June 2021, and this was following steroid injections at another clinic which showed no response. The steroid injection as a CT-guided dexamethasone located between my L4 and L5 discs, given with local anesthetic. This procedure was of no benefit. When she returned to L4, given like this procedure, Maria feels was of some benefit after 6 months of chronic pain. The first injections didn't help, but the second lot I went to a different place, Clinrad in Wynnum, and those worked. The first ones did absolutely nothing. So that's reduced me back pain by about 50%, and then it starts to come back after 6 months. But if during that time I try to do a basic task, like I thought, oh, maybe I could just sweep the garage a little with a light broom, and I tried, but within 10 minutes I went from a 4 out of 5 up to like, an 8 out of 10, and needed to come upstairs and medicate for that. So after 7 months of chronic back pain and is impacting her sciatic nerve, she noted 3 to 4 weeks of reduction of 50%. Maria still suffers flare-ups even after small tasks, causing her chronic pain to flare up. She has no assistance and this is urgently required so that her symptoms don't worsen, specifically her complex post-traumatic stress and clinical depression. Can't believe I haven't cried yet.